If you have thoracic outlet syndrome, it's almost guaranteed that you're going to perform some kind of neck or back exercise if you visit your doctor. But if TOS is created by some kind of compression in the thoracic region, which is the chest, then why are we focusing on strengthening the back and the neck muscles? To understand that, we have to take a look at the anatomy for thoracic outlet syndrome, starting with compression in the chest. Well, starting off with the pec minor. This is one of the main culprits when it comes to thoracic outlet syndrome and compression in that chest region. And the way it does this is by getting overactive and overused constantly will end up shortening, which will then result in the scapula here getting pulled towards the front. And that right there creates compression on all of these nerves and blood vessels that run right behind that pec minor. So when this happens now, we can then take a look at the back of the body and we can actually see what other muscles attach to the scapula. And in this case, that is the rhomboids. So what ends up happening here is when this scapula gets pulled towards the front because of that pec minor shortening, thanks to all that overuse, the rhomboids here will then get stretched out. And that is what makes them weak. So the whole point of you doing those back exercises is to help try to pull those rhomboids, is to try to pull that scapula straight back, which will then stretch out the pec minor and hopefully decompress on the nerves and blood vessels right behind it. Of course, the same thing happens to the neck muscles, and another reason why you'll do something like chin tucks. The reason is because you want to strengthen the deep cervical flexors, which is right here. Now, on top of that, the reason those muscles become weak, just like the rhomboids, is because you have the anterior medial and the SCM get chronically shortened and tight. So when this happens here, you can think of this almost like a tent. Let me screenshot. So what ends up happening here is you would have a normal tent like this, and you have a pole in the middle, which is going to be your better posture. This is what you would ideally want. But what ends up happening here is those SCM muscles pull the neck forward, which will then result in, let me just erase all this, which will then result in this side getting shortened, this side getting extremely stretched out, and then the pole getting leaned forward, right, your neck. Well, the whole point of strengthening the deep cervical flexors, these muscles here, is because it is going to help you basically strengthen this pole and help it kind of be in a straighter position. So that right there will hopefully begin to fight off those tight neck muscles in the front of the body, like the anterior scalenes or the SCM. And of course, there is actually one more main muscle that a lot of people miss, and that is going to be your deep shoulder muscle, the coracobrachialis. Because as you can see here, a lot of the blood vessels and the nerves still run right behind it. And again, this is a muscle that we tend to use every single day. The moment you lift your arm, you are pretty much using this muscle, which means it is prone. It is pretty much going to get shorn and tight. And that is why, again, your doctors are going to do something like external rotators or even some shoulder abduction. Because now, in order to fight off those coracobrachialis, those tight shoulders, you need to strengthen the muscles like the infraspinatus or the supraspinatus. And again, that's with your external rotator exercises and all that. Now, in my opinion, I truly believe that if you want to get rid of that thoracic outlet syndrome, then you have to release those tight muscles first that are making those muscles weak in the back. It's going to take you about 3 to 6 months for your rhomboids, for your deep cervical flexors to get strong enough to fight off the muscles that you are using every single day. So instead of trying to fight the muscles that you're using constantly, why not just try to release them first and then strengthen those weaker muscles by releasing, massaging out the tighter neck muscles, the tighter chest, the tighter coracobrachialis, and then doing those exercises after. You're going to allow those weaker muscles a better chance to activate and get stronger. And if you want to learn how to do all that step by step, then make sure to check out my program, 28-Day TOS Challenge. The link for that is in the description below. Or if you want to see how good these self-massage techniques really are, then make sure to check out the video up in the top corner to test it yourself.